I'm Mike Merson, and I'm the director of the Global Health Institute. You've been very patient. It's a pleasure to welcome all of you, parents, friends, families of our graduates, to what we refer to as the Global Health Certificate Commencement. I know many of you have traveled far, and we're really glad you could come early this weekend to be part of this. And of course, I want to welcome the class of 2012 Global Health Certificate students. And students, you can yell all you want, okay? You can do anything you want now because you're graduates. This will be a very memorable weekend for all of you that have traveled here and for our graduates. I want to acknowledge our faculty who are here. Those who are here are really some of the key faculty who teach our undergrads global health. They're individuals that teach, inspire, and mentor our students every day, and without them we would not be a thriving and growing institute, and I think our students would agree. Let me ask the faculty that are here to please stand. So let me tell you about these graduates. They're diverse, that's for sure. Among them is a future Fulbright scholar, a battalion chief in the ROTC, and recipients of the Davis Projects for Peace Award and other prestigious fellowships. Nearly 50% are graduating with distinction. They have 18 different majors, from civil and biomedical engineering to biology, public policy, and linguistics, and I know I left some out, I'm sorry. 6 are graduating in Program 2 or self-directed majors. Where are the Program 2s? Here. And they plan to have careers in medicine, law, business, international development, and among others. But really, our global health students are not just diverse. They are the best of the best, accomplished and talented in so many ways. We could not be more proud to be associated with such a special group of young people. I want to tell you about one of the students, not to embarrass anyone here, but Praveen Raghunathan has co-led the DGHI, the Global Health Institute Student Council, for 2 years and has been instrumental in organizing Duke's Global Health Week. He's known to his peers as Duke's biggest champion for global health. Using his background in public policy, he led a nationwide letter-writing campaign to decry threats to the congressional budget cuts to foreign aid. He also advocated for access to essential medicines and lobbied Congress for additional support for PEPFAR and the Global Fund. As an undergraduate, that's just remarkable. No doubt, Praveen's passion for global health is infectious. When combined with the skills and knowledge he has gained at Duke, it gives me hope for the future of global health and for our planet. That's just one story. I could tell many others of the students in this room. Now, parents and friends, your sons and daughters and relatives can tell you that this is an exciting time to be in the field of global health. It touches many aspects of our lives, from access to health care in this country to global threats like poverty, pandemics, and climate change. Globalization is real. Microbes and diseases know no boundaries, and they don't need passports to travel from country to country. Obesity and smoking kill millions around the world every year. We in global health seek solutions to global challenges as we work together across disciplinary and geographic boundaries. This is one of the principles of our Global Health Certificate. Students are crossing disciplinary boundaries to learn from one another and become informed, compassionate, and globally minded citizens. That's the mandate of the Global Health Institute, and that's what we expect from our students. Our institute celebrated its 5th anniversary a few months ago. We held a series of events that highlighted our accomplishments and goals for the future. Among these goals is to train the next generation of global health leaders. To our graduates, you have helped us accomplish this goal. We expect you to use your knowledge to take the field of global health in directions that cannot yet be imagined. I look forward to working with you in the future, but not as a student, but as colleagues in our quest to improve the health of people around the world. On behalf of the faculty and staff of our institute, to our graduates, I wish you best wishes and good luck. Now, before I ask Cheryl Broverman to come up, I'd like to make a special presentation. Every day, the passion of our students is nurtured and strengthened by our faculty. Our institute has around 50 faculty members, and there are even more faculty at Duke that conduct research or teach in our educational programs. Among these are some of the most dedicated and hardworking individuals I know, and I want to take a minute to recognize one of them today. We asked all our students to nominate a faculty member who has made a lasting impression on their education in global health. Overwhelmingly, they nominated one faculty member. Her students refer to her as Superwoman, a great teacher, but even a greater person, creative, passionate, encouraging, the quintessential example of a professor who sees student learning and intellectual development as going hand in hand. They say she empowers students to effect change and equips them to do so. Her students call this, and now you'll know who it is, the ADME effect. It is my honor to award the 2012 Outstanding Teacher Award to Catherine ADME, Professor of Public Policy and affiliate at our Global Health Institute. Catherine, thank you for your commitment to guiding and inspiring our students. Please come forward so I can give you this award. Stay here. So the faculty, students, and staff of the Global Health Institute recognize Catherine ADME for excellence in teaching and appreciation of your commitment to inspiring the global health students of Duke University 2011-2012. Thanks again.
Thank you very much.
So I now introduce Cheryl Broverman, but before she comes up, I would be remiss in not recognizing Cheryl, who has been the member of our faculty responsible for leading and growing the Global Health Certificate over the past 5 years. Cheryl will be not doing that after, you will be the last class that she will lead the certificate in, and we want to recognize her for what she's done. She's led this program since the fall of 2007. It started with 2 graduates to the 40 that you are today. In a recent article, Cheryl wrote, "My goal is not to produce more scientists or doctors, but young adults better equipped to think about the world around them and their place in it." In that piece, Cheryl wrote about evolution, noting that we are always evolving as individuals and as societies. We should look no further than the graduates with us today to see how this program has evolved under Cheryl's leadership. Cheryl, if you would please come up. I'm grateful for your dedication to our students and service to our institute. And as a small token of our thanks, I'd like to recognize Cheryl with this plaque, which we'll read. In appreciation, Cheryl Broverman, presented with gratitude for 5 years of service as faculty director of the Global Health Certificate Program and for your commitment to educating and inspiring the students of Duke University. From the faculty, students, and staff of the Duke Global Health Institute, May 2012. Thank you, Cheryl. Cheryl, you have to come back. One more applause for Cheryl, please.